One of the most common and harmful myths about homosexuality is that people who identify as LGBTQ+ can be easily recognized by their appearance, behavior, or interests. This myth is based on stereotypes and prejudices that assume that there is only one way to be gay, lesbian, bisexual, or transgender. However, this is far from the truth. People who identify as LGBTQ+ come in all shapes, sizes, colors, ethnicities, religions, and backgrounds. They have diverse personalities, hobbies, careers, and passions. They are not defined by their sexual orientation or gender identity, but by their individuality and humanity. Some people may think that they can tell someone's sexual orientation or gender identity by looking at their clothes, hair, voice, or mannerisms. They may believe that gay men are always feminine, lesbians are always masculine, bisexuals are always confused, and transgender people are always obvious. These beliefs are not only inaccurate, but also hurtful and disrespectful. They limit the expression and identity of LGBTQ+ people and force them to conform to rigid expectations and norms. They also create a hostile and unsafe environment for LGBTQ+ people who may face discrimination, harassment, or violence if they do not fit the stereotypes. The reality is that there is no one way to look or act gay, lesbian, bisexual, or transgender. LGBTQ+ people are as diverse and unique as anyone else. They may dress in different styles, have different tastes in music or movies, have different hobbies or sports preferences, have different religious beliefs or political views, have different goals or dreams. They may also have different experiences and challenges related to their sexual orientation or gender identity. Some may be out and proud, some may be closeted or struggling, some may be in relationships, some may be single. Some may face rejection or acceptance from their families, friends, or communities. Some may have access to support or resources, some may not. The bottom line is that LGBTQ+ people are human beings who deserve respect and dignity. They are not defined by stereotypes or myths, but by their own choices and identities. They are not a monolithic group, but a diverse and vibrant community. They are not a problem to be solved, but a part of the solution to create a more inclusive and compassionate world. One of the most common myths and misconceptions about homosexuality is that LGBTQ+ people cannot have healthy and fulfilling relationships and families. This myth is based on the false assumption that being gay is a choice, a disorder, or a sin, and that same-sex couples are unnatural, immoral, or inferior to opposite-sex couples. However, these claims are not supported by scientific evidence or human rights principles. In fact, there is plenty of evidence that LGBTQ+ people can have loving, committed, and stable relationships and families, just like anyone else. First of all, being gay is not a choice, a disorder, or a sin. According to the American Psychological Association, APA, sexual orientation is caused by factors such as genetics and the biology of brain development. Parenting, peer pressure, and religious struggles are not causes of homosexuality or heterosexuality. Homosexuality is no more a choice or decision than being straight. Moreover, homosexuality is not a mental illness or a defect.